By the time this video wraps, roughly 24 older adults will receive a dementia diagnosis. That's about 1 every 55 seconds. Now for the chilling twist: what if the culprit isn't age, but your own medicine shelf? We're told these pills are routine, safe, even indispensable. Yet emerging evidence is ringing the alarm. 97% of seniors have no idea that at least one drug they take could shrink critical memory hubs by more than 22% in under 9 months. Sit with that for a moment. In the pharmaceutical machine? It has had clues for years, while reaping tens of billions annually from medications that may be speeding cognitive decline in millions. One recent 2022 analysis in neuroaging research reported that a single drug class raised dementia risk by 43% within 18 months of use. In this video, we're counting down the 9 medications most strongly tied to rapid memory loss and dementia, ranked from commonly overlooked to truly devastating. Wait for number 3. It's handed out to millions for something seemingly minor, yet it can shrink vital memory circuits, and most people are never warned. Before we get started, drop a note below. Which prescriptions or over-the-counter products are in your daily mix, and have you noticed sudden brain fog or memory slips? We read every comment and reply with tailored insights. Your story could help protect someone else's mind, including your own. Alright, let's begin with number 9. Don't be fooled by its spot on the list. This one is in countless medicine cabinets, and it may be scrambling your cognition long before you feel it. 1. Anticholinergic polypharmacy. The most perilous driver of drug-related cognitive decline in older adults isn't a single prescription. It's the stealthy accumulation of several anticholinergic medicines taken together. This quiet stacking effect, known as anticholinergic polypharmacy, is what pushes vulnerable brains toward rapid confusion and memory loss. Consider a common pattern: a nighttime antihistamine to sleep, a bladder antispasmodic for urgency, and a low-dose tricyclic for pain. Each agent alone might cause only a hint of fog. Combined, they're anticholinergic load compounds, and the total burden surges. This isn't a hypothetical worry. A large cohort study in the past few years, following several 100,000 older adults for roughly a decade, reported that those with the heaviest cumulative anticholinergic exposure faced a markedly higher likelihood of developing dementia over the follow-up period. Here's what makes it so insidious: most people taking these drugs don't realize they carry anticholinergic effects at all. When acetylcholine signaling is blocked from multiple angles, the brain doesn't merely slow down, it drifts into an underactive state. Circuits go quiet, synaptic efficiency wanes, and the overall pattern begins to echo what we see in neurodegenerative conditions. The solution isn't a miracle cure, it's a thorough medication check. Ask your clinician or pharmacist to review everything you take: prescriptions, over-the-counter remedies, and supplements, and to estimate your anticholinergic burden with validated tools or professional software. From there, you can chart a deprescribing plan, tapering unnecessary items, substituting safer alternatives, and restoring a healthier neurochemical balance. This is the most empowering takeaway of all: drug-induced cognitive symptoms are often at least partly reversible. When the burden is reduced, many older adults recover sharpness, stamina, and recall over the ensuing weeks and months. Polypharmacy isn't just risky, it's preventable. That's why anticholinergic stacking stands as the top hidden threat to the minds of our aging population. 2. Antipsychotics. This category is particularly troubling because many older adults don't realize they're taking an antipsychotic at all. Medications such as quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were designed for schizophrenia and bipolar disorder, yet they're now frequently used off-label in seniors for insomnia, agitation, or dementia-related behaviors. In practice, that means powerful psychiatric drugs are routinely given in hospitals and long-term care settings to people who are simply confused, restless, or difficult to redirect. The fallout can be profound. A large cohort analysis published in 2021, following nearly 35,000 older adults, reported that those prescribed antipsychotics for behavioral symptoms had an approximately 58% higher likelihood of accelerated cognitive decline within 9 months, even among individuals with no prior dementia diagnosis. Beyond cognition, these drugs are tied to a greater risk of stroke, sudden death, and deep sedation, effects that cascade into falls, emergency admissions, and long-term institutionalization. The biology explains the clinical picture. Antipsychotics dampen dopamine signaling, a neurotransmitter essential not only for mood and motivation but also for executive function and working memory. When dopamine pathways are suppressed, the brain's responsiveness fades. Families often describe loved ones on these medications as dulled or flattened, their spark and personality slipping into the background. Turning this around begins with scrutiny. If you or a relative is taking one of these agents, ask why it was started and whether it's still necessary. Many behavioral issues can be addressed without drugs by establishing predictable routines, minimizing noise and overstimulation, treating pain, improving lighting, and reinforcing sleep hygiene. When medication is unavoidable, using the lowest effective dose for the shortest possible time reduces harm. Too often, these prescriptions persist out of convenience rather than need, and families are left watching a decline they assume is natural when, in fact, it is pharmacologic. 3. Paroxetine, Paxil. Paroxetine, marketed as Paxil, is among the most frequently prescribed SSRIs for depression and anxiety. It's often perceived as a newer, gentler option, but there's a critical distinction that rarely gets highlighted. Paroxetine is the only SSRI with distinctly strong anticholinergic activity, meaning it interferes with acetylcholine signaling in the brain. That single feature sets it apart from peers like sertraline or escitalopram and has major implications for cognition in older adults. A recent comprehensive review published in 2020, pooling data from over 18,000 seniors, found that those taking paroxetine exhibited measurable declines in immediate memory, verbal learning, and attention within 6 to 9 months of use. In the same analysis, older adults on paroxetine had an approximately 27% higher likelihood of early cognitive impairment compared with patients using other antidepressants. Here's the irony: it's prescribed to stabilize mood, yet over time it can blunt clarity, memory, and emotional regulation. The practical takeaway is straightforward: avoid paroxetine in older adults. The American Geriatric Society lists it on the Beers criteria as potentially inappropriate for seniors. If you're currently taking it, ask your physician about transitioning to safer alternatives such as sertraline or escitalopram, which are generally better tolerated and lack the same anticholinergic burden. Supporting mood with foundational measures, like ensuring adequate B vitamin status, especially B12 and B6, can also complement treatment choices. 4. Amitriptyline, Elavil. Amitriptyline is an older antidepressant that still finds its way onto prescriptions for nerve pain, poor sleep, and even migraine prevention. It can look like a versatile fix, but beneath that reputation sits one of the strongest anticholinergic profiles in common use, meaning it blocks acetylcholine, the neurotransmitter your brain relies on for attention, learning, and memory. The blockade is so pronounced that cognitive side effects aren't a remote possibility. With ongoing use, they become increasingly likely. In a large longitudinal analysis published in 2016, researchers followed more than 4,800 adults aged 65 and over and reported that those with the highest cumulative exposure to anticholinergic drugs, amitriptyline among the chief contributors, had an approximately 47% greater risk of developing dementia over about 9 years of follow-up. That isn't a trivial bump, it's a meaningful escalation in risk tied to long-term, additive anticholinergic load. What makes this especially unsettling is how quietly it unfolds. Many patients were never warned their sleep aid or pain pill could blunt memory. They started amitriptyline for insomnia or neuropathic discomfort, and gradually noticed short-term forgetfulness, trouble finding words, and a hazy focus. It doesn't require a hefty dose to cause harm. Even low nightly amounts taken steadily for several years can erode cognitive sharpness in the background, masquerading as just aging when the decline is in fact medication-related. If you or someone you care for is using amitriptyline, talk with a clinician about alternatives. For neuropathic pain, duloxetine or gabapentin may provide relief with far less anticholinergic burden. For sleep, consider melatonin or very low-dose doxepin, which has a much milder anticholinergic effect. And for mood symptoms, newer SSRIs such as sertraline or escitalopram are generally viewed as more brain-friendly options. 5. Benzodiazepines. Benzodiazepines, such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are among the most frequently given medicines for anxiety and insomnia. They amplify the effects of GABA, the brain's principal calming transmitter, dialing down overactivity. At first, they can feel like a lifeline. Racing thoughts settle, panic eases, sleep finally arrives. Over time, though, the relationship changes, and the medicine becomes a snare. Recent longitudinal research, tracking more than 12,000 older adults over roughly 5.5 years, found that people who used benzodiazepines for longer than 8 weeks faced an approximately 44% higher likelihood of receiving an Alzheimer's diagnosis during follow-up. The signal was stronger with long-acting agents like diazepam and clonazepam, which linger in the body and build up in fatty tissues, including the brain. What follows is a form of chemical quiet that blunts neural traffic. Learning slows, flexibility falls, processing feels heavy. Confusion, memory lapses, and emotional flatness become more common, not because the person is just getting older, but because the circuitry is being damped. Many seniors on benzodiazepines describe living in a haze, detached, dulled, not quite themselves. And when they try to quit, the backlash can be harsh. Rebound anxiety, agitation, and sleeplessness make the pill seem indispensable even as it fuels the problem. If you've been taking a benzodiazepine for more than a brief stretch, do not stop abruptly. Work with a clinician on a gradual taper. As the dose comes down, non-sedating options such as buspirone and skills-based therapies, especially cognitive behavioral therapy for anxiety or insomnia, can restore calm without taxing memory. 6. Statins. Statins rank among the most commonly prescribed medications worldwide, particularly in people over 65. They aim to lower cholesterol and cut the risk of heart attacks and strokes. Simvastatin, Zocor, and atorvastatin, Lipitor, are two of the best known. But cholesterol isn't only about the heart, it's foundational for the brain. The brain is roughly 58% fat by composition, and cholesterol is central to building and maintaining the myelin sheath, the insulating layer that keeps nerve signals fast and reliable. When cholesterol is driven down aggressively, the brain may be deprived of a key material it relies on to function. In a 2021 analysis reported in Frontiers in Aging Neuroscience, adults over 68 who had taken statins for at least 30 months showed an 18% higher likelihood of developing mild cognitive impairment. Those on very high-intensity regimens exhibited even clearer declines. Some patients describe abrupt episodes of forgetfulness, struggling to retrieve names, recent conversations, or familiar routes behind the wheel. Not all statins affect the brain to the same degree. Agents like pravastatin and rosuvastatin cross the blood-brain barrier less readily, and are generally considered less prone to cognitive side effects. If you've used a statin for years and notice fogginess, lapses, or confusion, speak with your clinician about adjusting the dose or exploring alternatives. Early action matters. Taking steps sooner gives you a better chance of safeguarding clarity in the years ahead. 7. Bladder control medications. Oxybutynin, ditropan, is a go-to prescription for older adults with overactive bladder or leakage. On the surface, it feels like a sensible fix. No one wants constant bathroom runs. But its action is to block acetylcholine, the same neurotransmitter often dampened by common antihistamines. And unlike milder agents, oxybutynin crosses the blood-brain barrier with ease, reaching memory hubs in the hippocampus and disrupting circuits that keep thinking clear. That's why prolonged use is particularly risky for seniors. In a 2020 cohort analysis reported in a leading medical journal, adults 67 and older who used strong anticholinergics, such as oxybutynin for more than 18 months faced an approximately 41% higher likelihood of developing dementia. In practical terms, that's about 2 in 5. The troubling part is that many patients are never told about potential cognitive effects. They're reassured the drug will calm the bladder, while creeping changes, foggy thinking, missed appointments, misplaced items, conversations that slip away, are chalked up to getting older rather than a medication effect. If you're taking oxybutynin and notice mental changes, it isn't just in your head, and bladder control doesn't have to cost you clarity. Newer options like mirabegron, Myrbetriq, work through a different pathway and have shown far less impact on memory. Because they don't block acetylcholine, they're generally considered a safer route for many older adults. 8. Proton pump inhibitors, PPIs. Prilosec, Nexium, and other proton pump inhibitors, better known as PPIs, are widely prescribed for acid reflux, GERD, and chronic heartburn. Many older adults end up taking them for years on end because symptoms flare the moment the drugs are stopped. What is often overlooked, however, is how these medications interfere with nutrient absorption, especially vitamin B12, a nutrient critical for protecting memory, mood balance, and concentration. In a 2021 longitudinal study of nearly 65,000 adults aged 70 and older, long-term PPI users had an approximate 32% higher likelihood of developing dementia compared with non-users. The risk climbed further in those on high daily doses. By suppressing stomach acid too aggressively, PPIs don't just block reflux, they impair the body's ability to absorb B12, magnesium, and calcium. These minerals are central to brain cell communication and electrical signaling. Without them, neurons misfire, resulting in confusion, mental lapses, and symptoms that can resemble the early stages of Alzheimer's. Research has also pointed toward another concern. PPIs may influence the buildup of amyloid beta plaques, toxic proteins that disrupt brain networks and are considered a hallmark of Alzheimer's disease. While the exact mechanism in humans is still under investigation, the association adds another layer of caution to chronic PPI use. The positive news is that there are safer paths forward. If you've been taking a PPI daily for months or years, speak with your doctor about a gradual taper, often supported by switching to H2 blockers like famotidine, Pepcid. These alternatives are less strongly linked to memory changes. For added support, natural options such as deglycyrrhizinated licorice, DGL, can help soothe the stomach lining without interfering with cognition. The key is early action. Don't wait until memory problems become entrenched. By reassessing your medication plan, you can protect both your digestive comfort and your long-term cognitive health. 9. Diphenhydramine, Benadryl. Diphenhydramine is the familiar over-the-counter tablet people reach for to sleep, tame allergies, or take the edge off a cold. Because it's inexpensive and easy to buy, it often sits in bedside drawers and medicine cabinets without a second thought. But inside the brain, this drug can disrupt the hippocampus, the hub for forming new memories, because it belongs to the anticholinergic family, agents that blunt acetylcholine, the neurotransmitter that supports alertness and learning. The older the brain, the more it depends on that cholinergic signal. Dial it down, and clarity, recall, and attention can falter. The risk isn't theoretical. In a 2021 population study tracking nearly 90,000 older adults, regular exposure to anticholinergic medications was linked to an approximately 39% higher likelihood of developing dementia over 6 years compared with minimal or no use. That's a sizable signal for a drug many assume is harmless simply because it's sold without a prescription. Protecting your memory starts with label literacy. Steer clear of products containing diphenhydramine, especially anything marked PM, nighttime, or allergy relief, which often hide the same ingredient. If you need long-term allergy support, consider newer, non-sedating options, such as loratadine, Claritin, that are far less likely to penetrate the brain. And while it's wise to rethink diphenhydramine, don't stop any medication abruptly without guidance. Over-the-counter does not automatically mean risk-free. If this video did one thing, I hope it made your medicine cabinet make sense. We uncovered how everyday drugs, anticholinergic stacks, antipsychotics used off-label, paroxetine, amitriptyline, benzodiazepines, certain statins, bladder anticholinergics like oxybutynin, long-term PPIs, and diphenhydramine, can quietly chip away at memory and clarity. You've seen the why: blocked acetylcholine, damped dopamine, deep sedation, blood-brain barrier penetration, and even nutrient malabsorption, and the what now: deprescribing with your clinician, safer substitutions, and non-drug strategies that preserve cognition. Your next moves are simple and powerful. Bring every prescription and OTC to a medication review. Ask about your cumulative anticholinergic burden. Taper, don't stop. When changing long-standing meds, explore brain-friendlier alternatives and shore up basics like sleep, movement, nutrition, and B vitamin status where appropriate. Many drug-induced symptoms are at least partly reversible. The sooner you act, the more your brain can rebound. If this helped, subscribe to the channel, turn on notifications, and share this video with someone who needs it. Drop a comment with the meds you're questioning. We read them and add resources in reply. Your clarity is not a luxury, it's your life. Let's protect it together.